Hi, my name is Alex Rabrenovich, and I'm your Health Benefits Director at LACERS. And I wanted to share with you some important information about the 2021 open enrollment period and health plan year. Now, we've got some really great news to share with you about 2021, but before we get to that, I want to make sure you understand that this is not going to be a typical open enrollment period. Usually, open enrollment runs for a month, from October 15th to November 15th. And during that time, you have the opportunity to enroll in a plan, change plans, or add a dependent. However, due to some unusual circumstances this year, we're going to extend open enrollment. So it's actually going to run from October 15th all the way to March 31st. You still have the opportunity to enroll in a plan, change plans, or add a dependent, but there are some restrictions that you need to know about, and I'm going to share those with you right now. If you are going to make a change during this open enrollment period, the first thing you need to be aware of is that LACERS will have up to 3 months to process your request. For example, if you submit all of your completed paperwork in January, LACERS will have up until April to process your paperwork, which means that your change's effective date may not be until May 1st. But please keep in mind that LACERS will do its very best to process your request as soon as possible. But we do have that 3-month window. Secondly, you can only make one change during this open enrollment period and cannot make another change for at least a year. What this means is that if the effective date of your change is February or after, you will not be eligible to make another change until open enrollment for the 2023 plan year, which will take place in October of 2022. Of course, if you have a qualifying event, you will be eligible to make a change. Finally, if you retire during this open enrollment period, you cannot change whatever health plan selection you made during the retirement process until next year's open enrollment period. You may be wondering why LACERS put these restrictions in place for this year's open enrollment. Well, the city is facing a fiscal emergency and in response has offered its employees that are eligible to retire a retirement incentive. The result of this is that LACERS has 3 times the amount of health plan enrollments it normally has for the next several months, and open enrollment only adds that much more to staff's workload. So these restrictions are meant to provide staff the flexibility and the ability to process everybody's request and serve the members as best we can given these unusual times. So let's move on to our 2021 health plan renewals. I am really excited to report to you that the 2021 overall premium cost of our medical, dental, and vision plans is only going to increase by less than 1%. Several of our plans didn't even have a premium increase, so that is really good news. Now, the overall cost of our program is about $130 million. But what's really fantastic is because of the great benefit that our members earn through their years of hard work for the city, over 90% of that cost is covered by the subsidy. So collectively, our members pay less than 10% of that cost out of pocket. And talking about subsidies, let's talk about the 2021 maximum medical and dental plan premium subsidies. As you may know, the LACERS board can only increase the maximum medical subsidy by the amount of increase in the Kaiser Permanente HMO two-party plan premium. Because that premium is staying the same for 2021, the maximum medical subsidy will also remain the same at $1,790.80 per month, which doesn't sound too shabby to me. This is the same amount available as a maximum reimbursement for members enrolled in the Medical Premium Reimbursement Program. In terms of dental subsidies, the maximum subsidy available for the PPO plan is going to remain at $44.60 a month, and for the HMO plan, it will remain at $14.38 a month. So I had mentioned that we had a really good health plan renewal this year. But what I didn't mention is that even with those minimal increases, we aren't seeing any copay changes. There are no changes to the coinsurance amounts, We've added some programs, and the carriers added some really great features to help keep you healthy. So why don't we take a look at those right now? So what's new with the Anthem Blue Cross plans for 2021? Well, the first great piece of news is that the Anthem Blue Cross PPO and Medicare supplement plans will no longer have a lifetime maximum. With lifetime maximums, when you reach a certain threshold in terms of cost of care, the insurance plan will stop covering you. These two plans were the only ones that we had that had lifetime maximums, and so we're really happy that we were able to negotiate them away. So now none of our plans have a lifetime maximum. Other good news is the Anthem Blue Cross HMO, PPO, and Medicare supplement plans with Medicare Part D have increased the prescription drug generic supply from 90 days to 100 days. Also, all Anthem Blue Cross members now have access to the Sydney app, which puts healthcare services at your fingertips, and telehealth is now covered the same as regular office visits for non-COVID related visits. We've added some really great programs to the Kaiser Permanente plans for 2021, and I am thrilled to tell you about Active and Fit. For years, members enrolled in our Kaiser Permanente HMO non-Medicare plan have been requesting that we add a fitness program similar to Silver Sneakers or Silver and Fit, but one just wasn't available until now. So starting January 1st, members enrolled in our Kaiser Permanente HMO non-Medicare plan will have access to free gym membership through Active and Fit. We are so happy to bring this to you, and now all of our plans offer a fitness program that will help keep you on the road to wellness. For members enrolled in our Kaiser Permanente Senior Advantage plan, you will see a new transportation benefit. It offers 24 free rides up to 50 miles each way to medical appointments and pharmacy. We know that transportation can sometimes be an obstacle to receiving care, and we wanted to help remove that obstacle. Also, all Kaiser members will now have some great resources. There's ClassPass, that offers online fitness classes. There's My Strength, an app that offers assistance with emotional wellness. And there's the Calm app, which helps you through meditation to reduce stress and anxiety. Members enrolled in our Scan Medicare Advantage plan will notice in 2021 that the 3-month supply for prescription drugs will increase from 90 days to 100 days. Also, Scan is offering some great resources through Brain HQ, which is a free brain fitness program that strengthens your mind through different games, and Health Tech, a free technology support line that provides training and education on how to use your computer or tablet to access medical care and/or information. And this is really great support knowing that technology keeps moving forward at a fast pace. For 2021, there are some changes to the United Healthcare Medicare Advantage plan that you should be aware of. Firstly, the Solutions for Caregivers program, which offers great resources and support to those providing care and those receiving care, is being dissolved at the end of 2020. We are sad to see this benefit go, but at the same time, we're thrilled to be bringing you a new transportation benefit. It will offer you 30 one-way trips to medical appointments and pharmacy up to 50 miles away. Again, we know that transportation can sometimes be an issue when you're receiving care, and we want to make sure we're doing everything we can to ensure you have consistent care. Also, the United Healthcare plan will be offering a post-discharge meal delivery program which offers 3 meals a day for a 4-week period if you've been discharged from an inpatient hospital or skilled nursing facility. Aside from the comprehensive benefits offered through our health plans, LACERS offers a wonderful wellness program called LACERS Well. This program provides educational events and workshops, newsletters, activities, there are field trips, and hey, we even have a Facebook page. And lately, we've began offering more virtual online opportunities, so you can access our program from anywhere. We hope that you'll join us. You can find more information on our website. Well, my name is Alex Rabrenovich. I oversee the Health Benefits and Wellness Division at LACERS. LACERS Well is part of that division, and so I, along with Stephanie Smith and Crystal Baldwin, plan and strategize to bring wellness opportunities to our retirees.
My name is Stephanie Smith, and I'm a wellness program manager with the LACERS Well program. And my role is to oversee the daily operations of the wellness program.
This is Crystal Baldwin, and I am the LACERS Well Champion Coordinator. And my role as the Champion Coordinator is to recruit LACERS retired members to the Champion program.
So LACERS Well, it's a program, it's more than a wellness program in my mind. It's really about well-being. It encompasses 5 basic principles of purpose, health, financial wellness, community, and social engagement.
LACERS Well really is an innovative program. It's not just about your mental, physical health. We also look at the holistic person, and we really want to make sure that we're providing you with all the resources and tools that you need in order to live out the best retirement possible.
Attending our workshops, attending our seminars, registering online, and supporting our champions who have activities in place, to continue to exercise, to continue to socialize and engage with one another in the community.
Where I see LACERS Well in the future is where our members, where other entities, other organizations are coming to us and looking for our retirees to teach them how to live out the best retirement possible, where they're really impacting the whole community around them.
I see the LACERS Well program expanding. We have a lot of retirees that actually reside out of the state of California, even out of the country. And that's my goal, is to expand our reach as far as keeping our retirees active no matter where they are.
Well, our goal would be for the retired members to really take hold of it, take ownership of it, and have it be a self-sufficient, growing, evolving program. Ideally, I would love to see us being overrun by the members and, them kind of just pushing us aside and saying, "We've got this, get away." Because of the COVID pandemic, LACERS is unable to have the open enrollment meetings that we've had in the past. However, we are going to offer virtual open enrollment meetings where you can hear from each carrier, ask questions, and learn more about the program offerings for 2021. There's more information available on the website. You can register through My LACERS or call LACERS. And if you miss a meeting, don't worry, we're going to be recording them and placing the recording on our website for future reference. Make the LACERS website your open enrollment resource. On there you'll find all kinds of information about our health plan carriers, the 2021 plan year, and open enrollment. You can register for an open enrollment virtual meeting. You can sign up to have a conversation with one of our health plan carriers, and you can contact LACERS with any questions that you have. I hope this video answered your questions or addressed your concerns about open enrollment in the coming plan year. Just know that if you have any questions along the way, you can always contact LACERS and we'll do our best to serve you. Also, I want to encourage you to take advantage of our LACERS Well program. We have a lot of great offerings, virtual and hopefully back to in-person in the near future, to keep you socially engaged, to inform you about ways to stay healthy, and really just to get the most out of your retirement. So stay well, and hopefully we'll see you soon. Have a good day.